the public and the permanent secretary.
A total of 22,331 students, of whom 3,449 were final candidates and 18,882 were continuing students, who wrote their allied health examinations from 223 examination centers in June this year. While presenting the results of the final candidates, Joseph Agundua, the Executive Secretary of the Uganda Allied Health Examination Board, noted that out of the 3,441 final diploma candidates, 2,328 were male, while 1,113 were female, but the majority of the candidates who were assessed were male.
However, Diploma in Medical Records and Health Informatics program had more female candidates. That is 21, which is 62%, compared to the male candidates who were only 13.
According to the Executive Secretary, there was an increase of 8.6% in the overall performance of the candidates across the 15 programs that were assessed. 2,809 candidates passed compared to the previous academic year, where only 2,359 candidates passed out of the 3,232 who sat for these exams.
Out of the 2,809 that passed, 1,870 were male and 939, that is 33%, were female. 84% of the females assessed passed as compared to 80% of males.
However, the body noted cases of exam malpractice and the results of 3 candidates were subsequently cancelled. Releasing the results, State Minister for Higher Education John Chrysostom Miengo commended the board and the health training institutions over the improved performance.
This is a great achievement for the Human Capital Development Program. This number will add more competent health workers to the existing workforce for the health sector and it has a ripple effect on service delivery.
The minister, together with the permanent secretary of the Ministry of Education, Ketty Lamaro, highlighted the ministry's plans of reviewing the training curricula of all health training programs in order to make them competence and skills-based.
The method is tailored to meet different learning abilities and can lead to more efficient student outcomes.
And this exercise will not be piecemeal, but holistic in its coverage.
In line with reviewing the curricula, efforts are also being made to expand the programs offered to ensure that they meet the health needs of the country's population.
Some of these programs include the Diploma in Emergency Care and Diploma in Medical Theatre Techniques, among others. Honorable Minister, the same processes are also being adopted for the nursing and midwifery field with courses such as the critical care nursing.
Whatever cost we're introducing should be in the structure of government so that when we send out these students, we know that there is somewhere they can be recruited. When we pass out our students, we know that they are relevant, they are not floating, they are not redundant.
This will be done alongside the merging of the Uganda Allied Health Examinations Board and the Uganda Nurses and Midwives Examination Board into one entity.
And through this reform, government intends to make competencies and awards gained by our trainees more credible in the East African community and elsewhere in the world of work.
We request that the ban on recruitment of staff pending merger be selectively considered so as not to paralyze the work between now and the planned merger in July 2024. As of now, the board secretariat is operating at half capacity of its required human capacity.
Joyce Nakato, NTV Weekend Edition.